Hi, my name is Matt Boone, and I'm a social worker and ACT therapist, and I'm here with my colleague, John Armando. Both of us are social workers, and we'll be talking today about the non-traditional roles we take on as social workers, roles that are not just doing psychotherapy in the 50-minute hour, and how we bring ACT and the psychological flexibility model to those roles. John, do you want to give a little bit of your background?
Yeah, well, I've been a clinical social worker for somewhere around 25 years or so, and have worked in a lot of different contexts. Started out in inpatient psychiatric hospitals and did some work with dual diagnosis, so a lot of experience with substance abuse. Eventually sort of worked my way into a private practice, which I've had for, somewhere around 15, 20 years. And I spent probably, the prior to joining my current company, I was working in primary care behavioral health, which was a lot of fun because I was both teaching residents, training counselors and social workers, and also working with clients in the primary care setting. So that was a unique opportunity.
Yeah, and I started off working in community mental health, and then really cut my teeth and learned ACT working in college health, working with college students and in doing outreach to college students to kind of reach people who might not otherwise come to counseling. And then worked at the VA for 5 years as both a therapist and an administrator and program developer, and then landed at my new job, which is in a tech business supporting other tech businesses with mental health interventions, where John and I currently work together.
It's great to have you in that.
It's good to work with you, John. So let's talk just a little bit, stepping back, about the social work mission. And how do you see the social work mission, John? And then how does ACT and the psychological flexibility model fit with that?
Well, I'll tell you, there's a lot of things that make social work, what it is. And I would say that that some of the things that are sort of inspiring to me about a clinical approach to social work, or social work as a clinical approach, is self-determination, which basically just means that for me, I think as a social worker, and I think there's lots of other disciplines that use the same approach, but as a social worker, I think it's part of the core of what we do, and that it is not really doing an intervention to a client, but it's really sort of eliciting from the client, what do they want, and helping them to really think through, what are they looking for, and then what would it take to get them what they're looking for. And so a lot of what I've worked with is motivational interviewing, which is very consistent with that. But I think ACT is also very consistent because, we talk about in ACT how our values are, self-determined or self-chosen. And then I think that when ACT works well, we're actually asking, our clients, whether they're patients or whether they're, employees at a business that we're working with, we're asking them to identify what kinds of behaviors work and don't work to move them in the direction of those values. So that's a big one for me.
I totally agree that the mission of self-determination for clients and communities is right in line with ACT. I also tend to think that our social work values operate at two levels. They operate at the individual level and the kind of community or group level. And so the thing that I think is really important in the social work mission is also like the social justice level, about how can we change the environment to make those environments more just and more supportive of people, by looking at poverty or racism, other kind of dynamics. And that we don't just try to help people adapt to their environment, that ideally we try to help environments adapt to people. So that's a really important piece of the social work mission, but it's tricky when you're doing psychotherapy, because mostly what you're doing is helping the person adapt to the environment. And so even when I'm doing an individual intervention, I'm kind of thinking about in my assessment, how are these broader forces, or how are institutions and other organizational factors contributing to the problem that we're seeing. That's where doing interventions that are a little different from psychotherapy come in. Like, I'm curious to hear about your experience working in primary care mental health integration, which is a way of like taking the tools and the wisdom of psychotherapy, but bringing it to where people are instead of waiting for people to come to you?
Oftentimes the clients that are referred to me, or sometimes not even referred, sometimes I might go into an exam room and just introduce myself and just kind of ask them what's going on and get a sense of what's important to them and what their health related goals are. But the point that I wanted to make is that usually when a client comes to a primary care office, they're not thinking that I'm going to see a mental health professional or a licensed clinical social worker or a psychologist. And so it's not really part of what they're expecting. They haven't really thought about, like, what would I say if somebody asked me, if I'm having any emotional problems or anything like that. And so I think that it's an opportunity to engage them in a kind of spontaneous way, but where they're not really sure yet whether they want anything that we have to offer. So I think that it's, it sort of allows you the opportunity to sort of present something to someone and ask them if this seems to have value to them or if it seems to be helpful to them. And so I think that constraint, if you will, helps me as a clinician to develop my skills, because I think that, when somebody comes in and they say, I'm here because I have this as a problem, or I want you to help me with this, that has its benefits, but it also has its aspects of that can cause problems, because a lot of times people have already created, to use some sort of my version of ACT terminology, they've already got a verbal sort of construction of what they think is wrong and what they think will help. And typically in ACT, we're really looking at sort of disentangling that so that they can really look more through their experience about what is, what actually works to make them more engaged in their life in a way that's consistent with their values. So, there's more, but that's just sort of a morsel.